Welcome to Firehouse TV. Today we'll teach you how to perform CPR, a skill that can save lives in emergencies. CPR, or cardiopulmonary resuscitation, is a crucial technique that combines chest compressions with rescue breaths to help maintain blood flow and oxygenation in a person who has suffered cardiac arrest. Knowing how to perform CPR can make the difference between life and death in critical situations. In this video we will guide you through each step of the process, ensuring you feel confident and prepared to act when it matters most. Stay tuned as we break down the essential components of effective CPR and provide you with practical tips and demonstrations. If you see someone collapse, first, check for responsiveness. Tap their shoulder and ask loudly, "Are you okay?" Next, check for normal breathing. This is a crucial step in assessing the condition of the unconscious person. First, gently tilt their head back to open the airway. Place one hand on their forehead and the other under their chin. Carefully lift the chin to ensure the airway is clear. Then, bring your ear close to their mouth and listen for any sounds of breathing. At the same time, watch for any movement of the chest. Do this for no more than 10 seconds. It's important to be thorough but quick. If you do not detect normal breathing, you must prepare to take further action immediately. Remember, every second counts in an emergency situation. If the person is not breathing, begin chest compressions immediately. Place your hands at the center of their chest and push hard and fast. Push to a depth of at least 2 inches. Allow full chest recoil. To start, kneel beside the person and ensure they are lying flat on their back on a firm surface. This position is crucial for effective compressions. Interlock your fingers and position the heel of your hand on the center of their chest, right between the nipples. Use your body weight to help you push down, keeping your arms straight. Perform compressions at a rate of 100 to 120 compressions per minute. This is roughly the tempo of the song "Stayin' Alive" by the Bee Gees. Count out loud to maintain the rhythm and ensure you are consistent. After every 30 compressions, check for any signs of life, such as movement or breathing. If there are no signs, continue with the compressions. Remember, the goal is to keep blood flowing to the brain and vital organs until professional help arrives. Do not stop unless the person shows signs of life, a trained responder takes over, or you are too exhausted to continue. Your actions can make a critical difference in the person's survival. Maintain a rate of 100 to 120 compressions per minute, roughly the beat of "Stayin' Alive." After 30 compressions, provide 2 rescue breaths. Tilt the head back, pinch the nose, and breathe until the chest visibly rises. Continue CPR until emergency responders arrive, or the person starts breathing on their own. Learning CPR can make the difference between life and death. Subscribe to Firehouse TV for more safety tips.